CCHT review exam questions. Total cell volume, TCV, is also called the fiber bundle volume. When preparing a new dialyzer, what is the total cell volume, TCV? The total amount of fluid the dialyzer blood compartment will hold. Which dialyzer characteristic explains how much water will be removed during a treatment? Ultrafiltration coefficient. In the function of kidneys, the proper balance of fluid and chemicals in the body is called what? Homeostasis. The dialysis technician must take care to protect water samples. When processing samples for bacteria, this should be done within 1 to 2 hours of gathering samples, or they may be refrigerated for later processing. If refrigerated samples must be tested 24 hours, what medium is used for testing water dialysate samples? Triptych soy agar. Fistulas are used to provide access to the bloodstream and provide dialysis. A fistula is autogenous, which means it is made from the patient's own blood vessels. It is important to understand the scientific principles of fluids used in dialysis. A solvent is a fluid. True. Hemodialysis is a very complex process based on a very simple principles. Hemodialysis will do all of the following except restore the kidneys to normal function. As of 1996, the Food and Drug Administration, FDA, requires dialyzers to be labeled with single or multiple use. Only multiple-use dialyzers can be reused and must contain a label stating they are reusable. What must be contained on this label? At least on way to reuse the dialyzer. Scientific proof the method used is safe and effective. Clinics should make sure the training program makes sense for their center to be cost-effective and meet training needs. What are the 5 areas of the training model you will access? Leadership, coordinator time, preceptors, flexibility, and funding. Dialysis is so complex that an entire team is required to meet the patient's needs. True or false? True. High-output cardiac failure is a complication of arteriovenous fistula or grafting. All of the following actions are a part of this condition except decreased cardiac workload. Using the National Kidney Foundation list of the stages of chronic kidney disease, CKD, which stage is indicated by a 15 to 29 glomerular filtration rate, GFR, and indicates the patient is ready for dialysis. Stage 4. CMS dialyzer labeling requirements include all of these except label must be no longer than 3 inches by 5 inches in size. In order to prevent bacterial growth, water that is contained in the product water distribution loop must have a flow rate of at least how much? 3 feet per second. In the process of dialysis, dialysate is the solution. What is the solvent? Treated water. Which type of training runs the risk of causing stress among trainees? Shadowing. The level of saturation rate in a liquid is determined by how much solute can be dissolved is called the _____________________ of a liquid. Concentration. Disease can be spread in 3 main ways. Which of these is not included in the transmission methods? Waterborne spread. A disadvantage of high-flux dialysis is pyrogen reactions are common. There are several dialyzer characteristics that are important in how the patient is treated, their level of comfort, and their safety during the dialysis treatment. Which dialyzer characteristic explains the rate of solute removal? Clearance. According to the guidance provided by the CDC, when washing your hands with soap applied, you should wash them for at least how long? 15 seconds. What are the 3 things that help control phosphorus levels? Diet, phosphate binders, hemodialysis treatments. In dialysis and fluid movement, solubility is defined as how well solid will dissolve in a solvent. A low-pressure alarm in the venous, post-dialyzer, line is likely to be set off by a blockage in the blood tubing before the monitoring site. Which of these are good reasons to develop a preceptor training program? All of these, a cost-effectively way to develop competence, enhance professionalism, promoting the appeal of your clinic to prospective employees. CMS dialysis technician standards require that dialysis technician training programs include which of these subjects? Possible complications.